During the past 20 years, obesity among adults has risen significantly in the U.S. and has become an epidemic. According to the Centers for Disease Control, 34% of U.S. adults 20 years of age and older, over 90 million people, are obese. 67% of Americans are overweight. These increasing rates raise concern because being overweight or obese increases the risk of many diseases and health conditions.
Well, for a long time, decades, obesity was looked at as a moral failure. And patients were treated with a significant amount of bias, but I think those medical problems that were associated and are associated with weight gain really brought attention to the issue of obesity. Diseases such as diabetes, which is at epidemic proportions, type 2 diabetes, hypertension, coronary artery disease, cancer. There's a whole litany of medical problems that are caused from obesity, and nearly all of them can be improved or completely reversed with losing enough weight.
Obesity is commonly the result of complex genetic, cultural, and psychosocial issues that culminate in overeating and a sedentary lifestyle. Researchers now believe that obesity may actually be a form of substance abuse where food is the substance of choice.
There's a genetic component that goes along with it, but in its purest sense, it is a form of addiction. It's a comfort food. There's the primary effect when you're hungry, but what we call head hunger, other reasons that you eat besides being hungry. And when we look at brain scans, functional brain scans of addicts, we find no difference from somebody who's obese and even thinking about food than to people who have drug problems, cocaine, methamphetamine, alcohol problems, sex addiction, gambling addiction. In the big picture, the substance is not the main issue. The substance is what a person is using to feel better.
For those with severe or morbid obesity, weight loss surgery may be the only viable solution to substantial and durable weight loss. The increasing number of morbidly obese patients and the growing popularity of weight loss surgery in America make it one of the most common surgical procedures performed in the United States.
Why don't you level her out a little bit?
Dr. Todd McCarty is a bariatric surgeon in Dallas, Texas.
What we've seen is a transition from what used to be open surgery to laparoscopic surgery, which is essentially doing surgery looking on a television monitor, but they still require incisions in the abdominal cavity. It was a huge leap forward for patient care. It's more patient-friendly, it works, and it's safe. But in that light, laparoscopy isn't the end of the journey. How do we take it to the next level without making incisions on the abdominal cavity or with making fewer incisions on the abdominal cavity? So natural orifice surgery is kind of the next step in the evolution of surgery, and that is we use a natural orifice, such as going down the mouth through the esophagus with an endoscope and gaining access to the abdominal cavity where we can do parts or all of the operation.
Dr. McCarty has been at the forefront of surgical innovation for 15 years and has educated thousands of patients and hundreds of surgeons from his practice, Lakewood Weight Loss and Wellness, in the Dallas area. He believes natural orifice surgery is simply the natural progression of surgical techniques.
It markedly decreases the pain for the patients. It improves the cosmetic appearance and it shortens their recovery time. So anytime that it's better for the patient, it's going to be popular.
I had the gastric sleeve and I chose that because it just seemed like the perfect choice for me. And I was having surgery, I was having a hysterectomy, so I asked Dr. McCarty if he would please perform both at the same time. I've lost a little over 100 pounds and at this point I'm happy with my weight. If I lose a little bit more, I won't be upset obviously, but I'm content with where I am right now.
While weight loss surgery will certainly help patients lose weight, Dr. McCarty feels it is crucial to deal with the underlying issue that caused the weight gain in the first place in order to prevent post-surgical weight gain.
There's not a magic pill for it. See, it's self-awareness. It's understanding what it is in your life that's driving it and what can trigger you, what kind of environments trigger you, and being self-aware of that and then avoiding those. And when they happen, if you wait until you're in an environment and you're triggered for comfort, there is no debate. You'll eat, or if you're an alcoholic, you'll drink, or if you're a drug addict, you'll use. You have to be aware of that before and control your environment. Do we have the scope in here? The endoscope?
Lakewood Weight Loss and Wellness is the only weight loss surgery program in Texas to offer natural orifice surgery. Dr. McCarty is now able to perform the NOS procedure for most bariatric operations, including sleeve gastrectomy, gastric bypass, lap band, and others. If you don't like pain, don't like scars, and don't like prolonged recovery from surgery, then the McCarty weight loss surgery procedures may be the solution you've been looking for.
For our practice, it's routine. Virtually every patient will have their surgery done all or in part using natural orifice surgery. And the reason is because it makes sense. Why would you want to hurt more? Why would you want more scars? And why would you want a longer recovery? It doesn't make sense. And the patients understand that and they opt for it.
It helped me make changes in my life. It helped me on the journey that I needed to take so that I could make the change in my life so that I could live again.
When diet and exercise fail to get the results that you desire, weight loss surgery may be the answer. If you're considering weight loss surgery, you owe it to yourself to find out if Dr. McCarty's scar-free and pain-free procedure is right for you.
Clean the camera.
To learn more about Dr. Todd McCarty and his revolutionary weight loss techniques, call today or visit lakewoodweightloss.com.